Audience, this is a look into music intervention as adjunctive treatment to burn rehabilitation. Defining burn rehabilitation and music therapy are first on the agenda. If you were to go to a hospital and ask for a music therapist, you would have someone with a minimum of a bachelor's degree at an American Music Therapy Association approved school and a certification by the Certification Board of Music Therapists. The Certification Board of Music Therapists is a separate group from the American Music Therapy Association. Music therapy defined as the clinical and evidence-based use of music intervention to accomplish individualized goals. The aim of burn rehabilitation is to minimize the adverse effects caused by burn injuries. And these are individualized goals set out in the definition of burn rehabilitation that music therapy will help a patient to accomplish. There are some noteworthy terms on this slide in regards to what a contracture is, and without ongoing advice and presence of mind and care from the whole burn team, a lot can go wrong. So, burn patients need whatever they can get, whatever edge they can get in regards to pain and anxiety. We must ask ourselves, in what way can we ease the passage of time for the patients? It's the departments of kinesiology and family medicine at McMaster University conducted an experiment. 20 people with moderately active lifestyles ran sprint intensive training, 30 seconds of high intensity sprinting, and 4 minutes of rest. One group had music and one did not. A correlation was found between music and performance and perceived enjoyment. In this study, 70 patients were studied, 35 in a control group and 35 in an experimental group. Anxiety and pain levels were assessed before and after and during dressing changes, and there was a correlation between lower anxiety and lower pain levels in the group with music. Lee and others analyzed 17 studies with music and physical activity outcomes in mind. A positive correlation between music therapy and pain alleviation was noted. However, it was also noted that more studies are also required. So in summary, a person's motivation is in part determined by their pain level. Alleviating pain is key to ensuring participation in procedures and exercises, which are both essential to burn rehabilitation. Music intervention increases a person's ability to communicate experiences which are alienating. There's also scientific data which suggests music therapy can help to alleviate symptoms of PTSD. There is a lot of negative emotions which can arise from being seriously harmed. Landis, Shack, and others analyzed 25 articles for their efficacy on treating people exhibiting symptoms of post-traumatic stress disorder. It was noted that music therapy may be a useful tool for reducing symptoms and improving functions. of people with trauma exposure. Although, in this case, it is also noted that more empirical data is required. Emotional and physical abuse, unless experienced and overcome by an individual, can be difficult for said individual to relate to. This type of music therapy, feminist music therapy, aims to rehabilitation of females who experience domestic abuse. This addition is noteworthy because it added to my understanding of people experiencing domestic abuse, particularly the last 3 lyrics in this stanza. So, music in regards to burn rehabilitation has 2 roles. The first is to relax and create an environment for the patient. The second is empowering the patient to communicate complex ideas of isolation and pain while abolishing the stigma of visible scars. More information on the details of music therapy in regards to rehabilitation is required for a more comprehensive understanding of the subject.